tube called the eustachian tube, and that connects to the back of the nose, more specifically the nasopharynx. And the eustachian tube is under normal resting state closed, and it's closed for a reason, because if you have an upper respiratory tract infection, we don't want that infection travelling up the nose, up the eustachian tube and invading the middle ear, because that will cause a middle ear infection. So the eustachian tube is actually shut at the back of the nose, and it momentarily opens during the course of the day without us even realising. So when we swallow, yawn or chew, it's a voluntary response. The eustachian tube, the muscles either side, and it opens near to the back of the nose. The muscles are there. The upper part of the eustachian tube where it connects to the middle ear is made of bone, so that's not really going to open. But the eustachian tube where it connects to the back of the nose is made up of cartilage, and there's muscles either side, and these muscles contract, causing the eustachian tube to open, and the air pressure can equalise. And whilst the eustachian tube opens, it can also help fluid that collects behind the eardrum to drain away. So it has got a dual function. Not only is it a pressure equalising tube, it's also a drainage pipe, a bit like a pipe we have in our kitchen. It allows any excess fluid behind the eardrum to drain away, because we don't want fluid behind the eardrum. Now, my auntie had grommets fitted back in 2018, so I'll come back to that in a moment. So this is appointment 3. This is my auntie today. Her ear was still discharging. It's been a week that she's been using the oral antibiotics. There's been minimal change in her symptoms. Now, when I examined the ear, there was less discharge. And what I'm trying to do here, I'm just trying to remove some of this soft, wet skin at the canal entrance. I'm now going towards the eardrum now. Please do watch. If you're up to the video now, you're going to see some really interesting things going on in the next 10-15 minutes. And I'll explain that in a moment, what's going to go on. But don't leave, because this is going to be really, really interesting. So my auntie's eustachian tube was blocked, and eustachian tubes can get blocked for a number of reasons. We could be congenitally born with a narrow eustachian tube, so it just doesn't really open. Most children do have a narrow eustachian tube, and it does widen as they age, and so a lot of children can suffer from middle ear infections as a result. It could be that the muscles that normally contract and cause the eustachian tube to open have become weakened or paralysed, or there can be some sort of obstruction, inflammation at the back of the nose, blocking the entrance of the eustachian tube. So it could be, you might have enlarged turbinate, sinusitis, rhinitis, nasal polyp, congestion there, inflammation, mucus. And my auntie had a blocked eustachian tube in both ears, and it was causing her great issues, ear pain, hearing loss, muffled hearing. So we tried everything we could to help unblock the eustachian tube. So my auntie used nasal decongestants, and also was prescribed some medication, but the eustachian tube just wouldn't open. So my colleague, Mr. Ajali, fitted my auntie with bilateral grommets. And what a grommet is, because the eustachian tube is blocked, and because air can't enter the middle ear via the eustachian tube, a grommet is a bypass. So it allows air to enter behind the eardrum via the ear canal. And by having a hole in the eardrum, it automatically equalises the air pressure. The air pressure either side of the eardrum is automatically equalised because you've got a hole in the eardrum. There is no boundary, there's no membrane now separating the middle ear and the outer ear, so the air